I'm Dr. Amy Stinson, and we're going to be discussing tonsillectomy and adenoidectomy. More than likely, your primary care physician has referred you to an ENT surgeon to discuss these procedures. The most common reason we perform a tonsillectomy and adenoidectomy in children today is for obstructive sleep apnea or sleep disordered breathing. This is a very common thing that we see these days. Most of the time, your child will be a very loud snorer. They're also a restless sleeper. There may be behavioral issues at school and difficulty potty training. You may also see them grunt or gasp in their sleep or even wake themselves from their sleep because of their breathing issues. We also do a tonsillectomy and adenoidectomy for chronic tonsillitis. When you're starting to have multiple infections a year for many years, or you're having infections that are becoming resistant to antibiotic therapy, those are also reasons to consider having your tonsils and adenoids removed. If you've become a strep carrier, this is also something to consider. The amount of days that your child may be missing from school are also important. If they miss more than 1 to 2 weeks of school a year because of their strep throat or chronic sore throats, this is also something to consider for tonsillectomy. The surgery itself is performed in the operating suite. Your child will be put completely to sleep, so they won't know anything that's going on during the procedure. They'll more than likely be given an oral sedative before this point as well to help calm their nerves and give them some amnesia for the procedure itself. If your child is under 11, they won't have to have an IV started until they reach the surgery suite, and they're able to give them a little bit of mask anesthesia to put them to sleep. This can put a lot of children's fears at ease that we're able to do this. However, if they're over 11, usually we think that they're big enough to be able to have the IV started on their own. So that's something to prepare them for in advance. The surgery takes only about 20 minutes to do. Everything is done through the mouth. We take out the tonsils that are on the sides of the walls, and usually if we're doing the procedure for obstructive sleep apnea or chronic tonsillitis, we'll also recommend removing the adenoid pad. This is a third tonsil that sits in the very back of the nose. If we were able to lift up the palate and look directly behind here, this is where the adenoid pad sits. So it's very easy to access while your child is sleeping through their mouth. We remove the tonsils using a form of cautery so that it helps close the blood vessels at the same time that we're dissecting the lymph tissue away from the muscle. Most of the time, this can be accomplished within about 20 minutes or so. After the procedure, your child will have an incredibly sore throat. The kids that have chronic tonsillitis issues actually tend to do better post-operatively because they're used to feeling like their throat is raw or very sore. The key to getting through this is to drink plenty of fluids. Hydration is your friend. And fluids aren't restricted. They can have milk, juice, water, whatever they feel that they want to drink. We want them to be able to do that. If their child wants to eat, that's something that we don't restrict. However, usually starting off with soft foods is the best and progressing on to more solid foods from that point. However, if they feel that they want to eat the first day after surgery, that's something that you should allow them to try. The sooner they can get back to a normal diet, the better they're going to feel. We also prescribe you prescription pain medications. This will also include a numbing tetracaine sucker. This can be very effective in children in helping them take their pain medication as well as getting fluids down. Especially if you're having trouble with little ones, you can have them suck on the sucker for a few minutes, put it back in your refrigerator. As their throat gets numb, then you can have them take their pain medicine and drink some fluids. They should be drinking about a cup of fluid every hour that they're awake after their surgery. Usually for the first few days, kids tend to do pretty well, and then there can actually be a drop-off or a slump in their attitude for the next couple of days. This is normal if you do see this, so don't worry. It's also normal for kiddos to run a fever after surgery. As long as the fever isn't too high and they're taking in plenty of fluids, this is a normal reaction to the anesthetic, so don't worry. We expect your child to complain of ear pain. This is also normal. If they've had issues with their ears in the past, they may say that it feels the same as having an ear infection. Most of the times they don't, though. This is because the nerves that run through our throat actually go up through our ears before they enter into our brain, and it makes us think that our ears hurt when it's really our throat that's bothering us. They also may complain that their tongue feels funny temporarily after surgery, and this is strictly because of the way that we have to hold their mouth open to access their tonsils to remove them. The biggest, most specific complication to the surgery that we worry about is bleeding. Bleeding can be significant from the tonsils because of their lymphoid structure. They have quite a few vessels that actually feed them. If you do see bleeding, the most common time for this will be around 7 days after surgery, as those scabs start to heal and slough off. If one sloughs off before it's completely ready, you may see some bleeding. This could be in the form of pink saliva or gross blood coming out from the mouth. If you do see this, you do need to alert your ENT so that this condition can be resolved. I encourage you not to look in your child's mouth after surgery. When the scabs start to form, it will actually look like they have what's called a thrush or a fungal infection, but this isn't the case, so don't panic if you do look. It will look like a nice white coating along all the edges where the tonsil tissue was removed. This coating actually may give them some significant bad breath, so don't worry. As these start to slough, that will improve. If we did the surgery for sleep apnea symptoms, if the tonsils were significantly enlarged, you may notice breathing improvement immediately. However, there will be residual swelling after the surgery, so children that may not have snored may snore temporarily, or if your child snored before, this may persist during the healing process. This is normal. If we did the surgery for obstructive sleep apnea or sleep disordered breathing, you can actually expect to see an improvement in your child's sleeping fairly quickly within a few weeks. This may result in improved potty training, improved behavior, and improved performance at school. We hope all of these things will benefit your child. If we did the surgery for chronic tonsillitis, most of the time this is very effective in removing all of the bacteria that causes strep tonsillitis. However, it is still possible to have strep throat without your tonsils and adenoids. The literature quotes this anywhere from 3 to 20%. So if you still persist with sore throats, you need to seek medical attention just on the off chance that you may have developed strep. Tonsillectomy and adenoidectomy is a very common surgical procedure performed these days. It is also very effective in the treatment of sleep disordered breathing and chronic tonsillitis. Even though there are risks, those risks are minor. The risks of major bleeding after the surgery are less than 1%. If you are concerned or you have questions regarding this procedure, please discuss it further with your ENT.